Hi all, today we are going to learn an important aspect in general pharmacology. From this picture, you can see the image of a baby born with limb defects. This condition is called as phocomelia, which is an adverse reaction that has occurred to a baby when pregnant mother takes the drug thalidomide. The occurrence of phocomelia in babies born to pregnant mother taking thalidomide led to the concept of teratogenicity. So today we are going to learn teratogenicity, which is actually the occurrence of abnormalities in a fetus when a pregnant mother takes certain drugs. This topic is important for prescribing doctors because we should know which all drugs are safe in pregnancy and which all drugs are contraindicated in pregnancy. Whenever we are writing a prescription, we should keep in mind that certain drugs are contraindicated in a pregnant and lactating women. So now let us go to the topic proper, teratogenicity. Definition: it is the ability of a drug to cause fetal abnormalities when administered to a pregnant woman at any stage of pregnancy and is detected at birth or later in life. The word teratos means monster and gen means to make. So the definition is the ability of a drug to cause fetal abnormalities when given to a pregnant woman at any stage of pregnancy and is detected at birth or later in life. Now let us see the 3 stages of fetus which are affected by the drugs. First stage is fertilization and implantation stage, which is from the time of conception to 17 days of gestation. The exposure to drugs during this period may cause failure of pregnancy in some cases, and this may often go unnoticed. The second period is the period of organogenesis, which is from 18 to 55 days of gestation. That is the most vulnerable period. The exposure to drug during this period may cause many abnormalities, especially anatomical and even developmental anomalies. So it is better to avoid drugs during the early trimesters of pregnancy. The third stage is growth and development stage, which is from 56th day onwards, and exposure during this period causes developmental and functional abnormalities in the fetus. So the most vulnerable period is the period of organogenesis, which is from 18 to 55 days of gestation. Now, the types of malformation occurring to the fetus will depend on the drug that is taken by the mother and the stage at which the teratogen exposure occurs. And the fetal exposure will depend on the blood level of the drug and the duration the drug remains in the maternal circulation. If the blood level of the drug is more and the drug is remaining in the maternal circulation for a prolonged duration, the chance of fetal exposure will be more. Now let us see some of the common human teratogenic drugs. The first one is thalidomide, which was actually reported first as a teratogen. Thalidomide causes phocomelia the C-like limb defects. There is aplasia of the limbs. There can be amelia, which is absence of arms. There may be hip dislocation and bone hypoplasticity. So now thalidomide, with the concept of teratogenicity coming up, thalidomide was banned from use and it is now used only for certain particular clinical conditions. Next is fetal Hydantoin syndrome. That is caused by phenytoin, which is an anti-epileptic. It causes cleft lip or cleft palate and digital hypoplasia and even microcephaly. You can see the image, the baby having cleft lip and cleft palate. There is microcephaly. There is also proptosis, depression of nasal bridge. Another common drug is alcohol, which can cause fetal alcohol syndrome. And it is characterized by certain abnormal facies of the fetus. There will be microcephaly and there may be facial dimorphism. There is low nasal bridge. Epicanthal folds will be there. There is short palpebral fissures, minor ear abnormalities, indistinct philtrum, micrognathia, and thin upper lip. It can also cause growth retardation, intrauterine growth retardation, and even decreased IQ for the babies. Next is warfarin, which is an oral anticoagulant, which can cause fetal warfarin syndrome when it is taken by a pregnant woman. It can cause depressed nose, eye and hand defects, and growth retardation. Tetracycline, a broad spectrum antibiotic, it can cause discoloration and deformities of teeth, and there can be retarded bone growth. Sodium valproate and carbamazepine are anti-epileptic drugs, and they can cause neural tube defects in fetus when mother is taking these drugs. So this is a list of some human teratogenic drugs. You can see thalidomide, which can cause phocomelia, as we already discussed. Anti-cancer drugs like methotrexate can cause multiple defects and even fetal death. Then there are hormones like androgens, progestins, which can cause virilization of the baby and other esophageal and cardiac defects. Tetracyclines, we already said, they cause teeth and bone abnormalities. Warfarin causing fetal warfarin syndrome. Phenytoin causing phenytoin fetal Hydantoin syndrome. Then there is carbamazepine, sodium valproate, which can cause neural tube defects. Then alcohol causes fetal alcohol syndrome, which is characterized by decreased IQ, growth retardation, and facial dimorphism. ACE inhibitors, which are antihypertensive agents, they can cause hypoplasia of organs and even fetal loss. Lithium anti-manic drug, which can cause fetal goiter, cardiac and other abnormalities. Anti-thyroid drugs taken by mother can cause fetal goiter and hypothyroidism. Aspirin and indomethacin, which are NSAIDs, they can cause premature closure of ductus arteriosus. Isotretinoin can cause craniofacial, heart and CNS defects. It can also cause hydrocephalus. So this is a list of common human teratogenic drugs. So now, whenever we are prescribing, we should remember the contraindicated drugs in pregnancy, and we should look for that and prescribe them. So the US FDA has categorized drugs into different categories according to the risk to the fetus. So that is called a US FDA categories. So the category A includes the drugs with no risk to the fetus. So the studies have failed to demonstrate any risk in the fetus. It includes magnesium sulfate, thyroxine. These drugs can be safely given in pregnancy. Next is category B, where there is no evidence of risk in the humans. So there is no evidence of risk when the drug was given to humans, or during animal studies, there may be some adverse effects. So these drugs are also comparatively safe in pregnancy, and they include the penicillins, paracetamol, erythromycin, lidocaine, cephalosporins. So you can see the antibiotics, penicillins, and cephalosporins and erythromycin are safe in pregnancy. Category C is where the risk cannot be ruled out. The potential benefit may warrant use of drug in pregnant women despite potential risk. And the drugs include atropine, corticosteroids, adrenaline, morphine, thiopentone. Then you have category D. Here, the benefits outweigh the potential risk. Here, there is evidence of human fetal risk. But what we do is we consider the potential benefits which are more than the potential risk. And considering that, we can prescribe these drugs. And these include the anti-epileptic drugs like phenytoin, valproate, and also aspirin. Here, these drugs are given to pregnant women because the cause effect of the epilepsy occurring to a pregnant woman to the fetus is more when compared to the teratogenicity of these drugs. So we prefer to control the epilepsy in the mother when compared to the teratogenic effect. It is better to control epilepsy. So we are giving these drugs, but with continuous monitoring. Category X is the drugs which are contraindicated in pregnancy. The studies in animals and humans have demonstrated fetal abnormalities, and the risk is more than the benefits in comparison. So these drugs include isotretinoin, ergometrin, and thalidomide. So they are never to be prescribed in a pregnant woman. So whenever we are doing the prescription, we should remember the category X drugs which are completely contraindicated in pregnancy, and always weigh the benefits and the risk. And if the benefits are more, then only we will prescribe the drugs to a pregnant and lactating women. So to summarize, teratogenicity is the ability of a drug to cause fetal abnormalities when given to a pregnant mother at any stage of pregnancy, and it is detected at birth or later in the life. Then we saw that the most vulnerable period of gestation is the period of organogenesis, which is from 18 to 55 days of gestation. Then we saw a common human teratogenic drugs and the drugs category according to which we should prescribe. The category X drugs are contraindicated in pregnancy. So whenever we prescribe, we should keep in mind the benefits and the risk, and only if the benefits outweigh the risk, we should prescribe drugs to a pregnant mother. Thank you.